Hello and welcome to this week's installment of a weekly health insurance news roundup brought to you by Health Insurance Online. There are a few big articles this week, first involving online health records, which is typically common because there are a lot of news lately about online health records, especially with the recent launch of Google Health. First, we'll start with Google Health. Google Health is partnering with Blue Cross and Blue Shield to synchronize their health records starting this fall. It'll be available to all Blue Cross Blue Shield customers starting in the fall, and is a big step in the right direction toward offering universal online health records. Microsoft is also partnering with a big online health insurance provider, Kaiser Permanente, and they're going to be doing a pilot program with their 100,000 and so employees to synchronize the health records between the systems of Kaiser Permanente and Microsoft's Health Vault. There was also an article in USA Today looking at the convenience and privacy concerns of online health records, kind of looking at both sides of the issue and saying that even though it is pretty convenient and the dreams of all these companies are to offer health insurance and medical records in one specific place, there are no laws covering the privacy or security of these health records. So all these companies have a long way to go, but it looks like they're taking steps in the right direction. The next article is an article in which Aetna CEO said to a Senate committee last week that even though there are positive gains in the health insurance industry, there are also a lot of gaps and a lot of problems. And he actually is a supporter of reform, including universal health care coverage through individualized mandates, as well as tax breaks for employers and employees. So it was kind of interesting to see the CEO of a major corporation, who usually seem resistant of such reforms, to actually embrace and support these reforms. The final articles have to deal with the rising numbers of the uninsured and the underinsured in this country due to the rising costs of healthcare premiums, prescription drugs, co-payments and the like, and how they're outpacing the wages of employees as well as the wages that employers are willing to give. And it was they're kind of sobering articles in which millions of people are foregoing basic health care even if they have insurance because they can't afford the premiums, or they can't afford the co-payments, or they can't afford the medication. So kind of depressing articles this week. So while there were some positive gains in terms of reforms and in terms of online healthcare, it looks like there was some negativity in terms of uninsured and the underinsured. So it's kind of a seesaw week. But that brings us to the conclusion of this week's installment of the Weekly Health Insurance News Roundup. And to see the full text of this article, go to Health Insurance Online. Thank you and have a wonderful day.